One I promised you. Now I just said I will very, very quickly go through all the other themes that I haven't already put on YouTube. So I put theme 1, I put theme 5, I put theme 6. So I'm quickly going to run through 2, 3 and 4 all in the same go, because literally the only thing that you need to change for 2, 3 and 4 is the wording. The wording is either going to be prevention, it's either going to be treatment, or it's going to be knowledge for one of those themes. Okay, so you're going to mention much the same things with just little tweaks here and there to the wording of them. Generally, who you put in prevention, you can also put in treatment, you can probably put in knowledge as well, but we'll just quickly go through that now. So medieval, again, most of the ideas for prevention, treatment and knowledge came from Hippocrates and Galen. So you can mention any one of them for any of the themes. Okay, and they centered around the idea of the 4 humours. Ideas from prevention, treatment and knowledge were all based around, if it wasn't Galen, Hippocrates and 4 humours would have been based around church and superstition. We've got things like barber surgeons were used to, bleeding was used to prevent, bleeding was used to treat. Bleeding was also a source of knowledge that came from the 4 humours, so generally it's a one size fits all in the medieval period. You might throw in other things like soothsayers, alchemists, etc, 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 but they're going to be relevant to any one of those 3 themes. Okay, literally everything is the same. If you think about the Black Death is usually the key indicator. Prevention methods are about preventing the Black Death. Treatments are about treating the Black Death. And knowledge, ideas about knowledge are again linked to the Black Death. So for that, it's very, very simple, very straightforward from the medieval. Now, the early modern. Again, we could talk about whether it's prevention, treatment, knowledge. There's more of a scientific approach. Initially, as we start off the early modern in 1500, is a lot of the old ideas like miasma used to prevent, ideas based around miasma are used to treat, and they're also the source of knowledge effectively. Okay, so initially we've got kind of like almost like a cooling off bit. Hermeneutics shuts down the monasteries, so ideas go backwards if anything. There's no church involved. So there's all those sorts of things going on in the start of the early modern. So you've got a bit of continuity initially before it starts to change. Now, a lot of the changes in prevention are to do with the plague, and EAM is a good example of that, where we know quarantine, sterilisation, etc, are used. There's also other key figures. Alexander Gordon could be used in prevention, he could be used in treatment, could be used in knowledge. So I'll put him in there as well. Wonder drugs, prevention, treatment and knowledge as well. The only really different ones that you might include, but again they could probably go into treatments, possibly just think about where you're using them. Vesalius, study of anatomy, which is mainly to do with knowledge, but obviously his ideas would have been used by surgeons to treat better. Paré and Harvey. And again, Paré probably would go in treatment as well, because he was treating gunshot wounds. He was also tying up ligages and things like that. So he very, very firmly fits into a couple of themes. Okay. Generally, you've got some other wacky ideas that I've listed on this page here, but in the early modern period, there are definitely clear things that you can use for all 3 themes. Now, where it really starts to change is in the industrial era. Again, you can use similar sorts of people, but there are other examples that you can use as well. So John Snow, clearly an example of prevention, but he also develops knowledge. Wouldn't use him as a treatment, because no treatment's really come out of his work. He removes the handle from water pump, uses the scientific approach. That's about it. So don't use him for treatment, definitely use him for prevention, probably use him if you talk about knowledge. Now, we've also got vaccinations. They are prevention and prevention only. I suppose you could put Jenner into knowledge. That's fair enough, but it's not a treatment. Okay. Now, Lister, Simpson, who are my top tips for coming up this year, they are most definitely treatment and they're most definitely knowledge. And you could possibly squeeze some of that. You could squeeze them into prevention because they prevented pain and they prevented infection. So that might be worth thinking about as well. I would also mention Koch and Pasteur for any of those 3 themes, because obviously they're to do with prevention, because germ theory then enables us to create vaccinations. They are for treatments, because understanding the germ means we can better effectively treat it. Further down the road, you get antibiotics, etc, etc. And you can use them in knowledge, because obviously they are probably the biggest move forward in terms of knowledge. Okay, so that's what I will be mainly basing my ideas around for the industrial period. Now, if we move on into the modern, Again, the slides I'm showing you are all to do prevention, but I'm talking a little bit about what could go to the other themes as well. So in terms of preventing in the modern, we go with like governments are no longer laissez-faire. That's a massive thing, isn't it, in the modern era? Governments encourage people to be healthy to prevent them from getting illness and disease. So things like 5 a day, cycle to work scheme, MMR, vaccines, obviously huge vaccine rollout programs. I've got vaccines for COVID now most recently. So you can mention all those things there. Now, in terms of treatments and knowledge, there's a whole range of things you mentioned in the modern. So you go from Marie Curie and X-rays. You could also come up with World War One. You could come up with the likes of Harold Gillies with the skin graft. You could come up with blood transfusions. Karl Landsteiner with basically the first brain surgeries using magnets. All of those things are relevant for treatment and are relevant for knowledge in World War One. Even things like Thomas Splint can be mentioned. Roll into World War Two, the big examples of treatments, antibiotics. Don't forget about your antibiotics. Fleming, who discovers it, and Florian Chain, who mass produced it in World War Two, impact being saving 20 million lives. Since then, in terms of treatments, in terms of knowledge, we could also mention things like CAT scans, PET scans, all the different scanning techniques. We can mention DNA in terms of knowledge and in terms of treatment. So obviously understanding DNA better enables us to treat things like cancers. You could also mention treatments for cancer or knowledge about cancer. Initially we've got Marie Curie, now we've got things like chemotherapy, radiotherapy, all those various different things. There's absolutely loads you could include in there. Hopefully that really helps in case themes 2, 3 or 4 come up. And that's pretty much everything covered very, very quickly. So good luck with those. Make sure you haven't forgotten about these for the exam, and good luck with that one.